hooking Bruno up to our ECG machine. The white will be going by his right elbow, the left black, and the red as well will go on his left. This will be monitoring his heart rate and the beats of his heart. We're going to put a little alcohol on it. Next, our SpO2. He's awake, so usually we put it on his tongue if he was sleeping, but you can put it on his lip or his ear, and that'll be monitoring his blood gas and how much oxygen he's getting. And his blood pressure. I'm going to take the cuff. This will monitor his blood pressure as he's under anesthesia. So we take it, put that there, listen for his heart rate. I'd inflate and then deflate until I hear his heart rate again. That's scary. Okay. So this is another form to monitor his heart rate. It's the esophageal stethoscope. If he was to be asleep, I would just stick it down his mouth, just a little while, a little bit about this much, and that would monitor his heart rate.
So after I had done a full physical on Bruno, his ASA grade would be a 1, since he's a healthy dog with no health issues or systemic issues going on. Also, Bruno has a small mass removal on his leg, so I'm going to be performing a suture removal. It's only about 1 stitch, so it's not a lot. Come here. But you always want to check for redness or swelling. Make sure that there's no discharge. The suture looks closed. Sometimes you can use hemostats. He's a dark dog, but you can see it pretty well. You're just going to grab along by the knot and then pull out. And that's your suture removal.
So I'm going to be placing a catheter in Bruno's back leg, a saphenous vein. So I'm going to shave the area. I'm going to scrub. Use the bevel up. I'm going to secure it with tape. You don't want to make it too tight. To put on the T connector, make sure the line is primed. And then flush, make sure it's in. Stay, Bruno. Stay, Bruno. Stay. I'm going to finish taping the catheter in. Boo. Since he is active, I'm going to put a tension loop in. And that's how you put a saphenous catheter in. So usually you would be able to tell if a cuff is inflated too much or too little. It would be in the patient, but you would fill up the cuff. It would be hooked up to the patient. And if the you'd fill it up with oxygen and you'd squeeze. You'd keep your head near the patient. You can hear air coming out. Or if you see the abdomen filling up, that means you know your tube isn't in the correct place.
So if I needed to perform a CPR on a dog, I would have my one hand under his chest, and the other one I would be doing compressions. And someone else would be breathing for him through an endotracheal tube.
This would be done in surgery, so it would be sterile, but I'm just demonstrating how to pass some surgical equipment. So for forceps, you would grab and pass over to the surgeon, making sure you're not, reaching over and touching anything with your non-sterile field. For a scalpel also, you would hold and pass this way. You don't want to pass directly with the scalpel facing the surgeon as well. That's it. So I'm going to be doing a post-surgical cleanup. You're going to make sure to wipe everything down. The plate, all the equipment that the pet used. You would remove the towel. We do the table. All the monitoring equipment that we use, we wipe down as well. We wipe the ECG lines, everything like that. We also then empty all the garbage bags that we used. After we do that, I would vacuum. We only use the vacuum that stays in our surgical suite. And then after, I would mop with the mop bucket that we only use in our surgical suite as well. So we use chamber bright in our autoclaves. I would make a single strip down. I would close it. I would run a cycle. Then I'd open it, I'd drain it again. I'd run another cycle. Then I would wipe it out, drain all the water, fill it up, then just drain the water again and let it cool, and then it would be ready to autoclave again. Some suture patterns would be a simple continuous pattern. This is for subcutaneous space to keep air when you need airtight or fluid tight, and that position is needed. Another one is a forward interlocking. This is mostly used in larger animals and it's a very strong suture line. Another one would be a simple interrupted. It's the most used. It's easy and quick. It's to close the skin and the muscle layers. The next one would be vertical mattress or far, far, near, near. It's a stronger suture pattern in areas of high tension, but it's very time consuming.